existing knowledge, and then put it in a format that others can utilize. And then that goes into application, that you are bringing together the knowledge and maybe even the integrated knowledge. You take a review of all of it and you develop practice standards, or you systematically assess different techniques. You're applying the knowledge that already exists into a clinical setting. And then finally, teaching, which is what I will mostly focus on today, is studying the teaching and learning processes. And so thinking about teaching in a scholarly way includes then what I'm going to go to the next slide, which is using some of Glassick's criteria for assessing what is educational scholarship. And you can see here that developing clear goals, adequately preparing, which is doing a needs assessment, using appropriate methods for the teaching that you're doing, so that if you are teaching about an ethical conundrum, giving a didactic lecture is not really the way to do that. It would be better to do a small group case study somewhere where you could really discuss the ethical issues. So are your methods appropriate to what you're trying to teach? Do you have significant results? Are you able to effectively present them? And then do you critique what you have already done? And I put it on in a circle on the side, you know, it's in both ways, because I think in terms of education, we're always going around that whole circle in like a quality improvement matrix. So you come up with a presentation and you look at it reflectively, and then you may adapt it and move it forward. And that's the way that we really pursue educational scholarship. When we're doing that, we really need to make sure that we have clear goals that are aligned both with our content and our evaluation. The best way to do that is that they're SMART goals, so they're specific, measurable, attainable, relevant, and time-based. And I love looking at Bloom's taxonomy verbs. So this is a way to look hierarchically at the assessment of learners. So do they have the knowledge that you, knowledge is kind of the foundational, and all the way up to are they able to evaluate. So depending on your level of learner, you can have higher order thinking skills or lower order thinking skills. And then on the right there, I have some verbs to avoid. And the reason I like to avoid know, understand, this is hiding this, learn, appreciate, become, grasp the significance of, those I like to highlight that those are not words to use because they're really not measurable. How do you know somebody knows something? You know that they know it if they are able to list something, or if they're able to compare and contrast a couple of things. So I think that's a really important, it's important to think about this in anything that you're doing in your career so that you can make it scholarly, which then allows you to be able to put it onto your CV. In terms of disseminating our work, we really think of 3 Ps. So it's that it's public, it's peer reviewed, and that it's a platform for others to build upon. And that really is what defines scholarship in general. And I want you to be thinking very broadly about what scholarship can be, especially for as we're thinking about our curriculum vitae and what we can add to it. It might be a case, it could be a podcast, a blog post, maybe something that's not a traditional peer-reviewed article, or it could be a team-based learning curriculum or videos that you create. So there's lots of different ways that we can think broadly about what our scholarship is and how we can put it into our curriculum vitae. Just wanted to call your attention to MedEd Portal very quickly. You haven't used MedEd Portal as a teaching resource. It is a peer-reviewed online journal of the AAMC. It's the Journal of Teaching and Learning Resources, and it is a great place to find existing curricula that have been peer-reviewed, but also to share your own teaching resources in a scholarly way. So if you are really involved in teaching, it's a great way to share what you do and have a PubMed indexed journal article. So the way you do this is it's an education summary report plus the actual teaching resource, a teaching guide, and then the evaluation tool. All of that is submitted and goes through peer review. And the educational summary report is somewhat like a traditional manuscript, but ends up having a focus more on the educational objectives and the educational methods, more so than the research methods. So I just want to call your attention. There's some standard educational summary report templates that you can use, and I will share all of these slides with you later so that you can access the links. If you're planning, when you're teaching, when you're in the clinic, as you're thinking about whether you want to disseminate something, you need to be making your plan for MedEd Portal. So it needs to be, all of the things need to be generalizable, they need to be standalone. You need to think about how you'll evaluate their usage. Can't include copyrighted images or third-party content, and you need to remember patient privacy. So just like to bring this again, and you'll see on my CV as I share parts that MedEd Portal has been one of the ways that I've been able to disseminate information. And this is what it looks like in the journal itself. This is something that I have published in MedEd Portal. And then I call your attention to, it has a bunch of the different appendices. So again, it's not just the article, but it's also all of the resources. And then the details that I've got the arrow to, that gives you a usage report in terms of, this part is the how many times it's been discussed in social media and things, but it lets you see the impact of your work, which is something that can be really helpful for when you're going up for promotion and you say, well, this has been used by these number of people or mentioned by that others. There used to be a way to download this, and I haven't figured it out yet, to know how many times your resource has been downloaded, but that's all helpful. So that's just my very, very, very quick kind of I'm trying to see if there's anything. I can't see the chat, so if there's something in the chat, if somebody can just let me know, that would be really great, because now I don't see it on my screen and I don't want it to be in the way of the slides.
I'll watch the chat for you.
Okay, thanks, Louise.
Okay.
Okay, great. So I'm going to just go ahead now and launch into the CV, but I really just wanted you to think about that in terms of your career, because all of this is doing work that you love to do and that it's important for you, that you're strong and skilled at doing it, but it's also important for your institution as you build your CV. So what I really want to talk about today, and these are the objectives of the talk, is going over the important components of an academic CV, some strategies to build your CV, and then we can perform a gap analysis of your CV, or at least you'll have the tools to be able to do that. So the goal of a CV is to provide an individual or a committee with an understanding of the scope of your educational background, your professional career, and your current research interests. So that's really what the CV does. And I like this slide to share a little bit of what the difference between a curriculum vitae and a resume are. So curriculum vitae is really your overall body of work. It's a document that contains all of your full professional story. So it includes your education, your licensure, it's your community service, your publications, awards, and it may be between 3 to 5 pages. Sometimes it's more than 20 or 30 pages. Whereas a resume is just highlighting some very key experiences, and you adapt it by the audience in terms of if you're applying for a job or something like that. And we don't tend to use the resume as much in academic medicine. It's a one-page summary, and it tells a broad, high-level story. So the CV is really a compilation of all of the different activities that you do. And so it's really important that you continue to update it. It's also in reverse chronological order. And so that's something important that I'm going to share with you as we go through this, the ways that you would want your CV to keep it updated. The other thing I'll just call a quick attention to is educator portfolios. Some institutions use this. I understand, I don't believe that yours does. Mine does not either. And there are both developmental and promotional educator portfolios. And these are just ways to keep all of your education work together and help you reflect about your educational activities over time. I'll just keep going because I don't think you use them. I prefer to go ahead and just put some of an abbreviated educator portfolio within the CV, because that seems to work better for communicating what we do as educators. So overall, there's some just very common kind of tips and tricks and strategies for keeping your CV current. And some of these things are just kind of, the font. You want to use the sans serif font. So like this one that's like Arial or Calibri that don't have the flourishes on the letters. You want to make sure that you're consistent in the formatting and so that it all lines up nicely. Because if it doesn't, that makes people think that you haven't spent time on maintaining your CV, and it doesn't show the good picture of all the hard work that you do. You always want to proofread it, and one of the ways to do that is to read it from the bottom up, and that can sometimes help you to find things that you may miss otherwise. Also, this next one about the dates, this one is actually really important, and it's kind of sounds silly, but you'd like your dates on the right-hand side, not on the left-hand margin. And the reason is because that will help you to more identify what you actually do rather than the date, because what you do is what is important. So that just that little change of the date being on the right rather than on the left really does make a difference if someone is reviewing your CV. Always be honest in your CV, document what you do and what you contribute. Don't overfill it. And sometimes that's something that can happen as I talk later about mentoring and some of the different areas. We can talk about what you do include and what you shouldn't include. And then keep your CV current. Make a time once a month to add things to your CV, or like today, right after I give, I do this presentation, I can add it to my CV, because that way you keep it up to date and you don't forget things. And so I'll do a little bit more about that in just a minute. On your CV, you don't want to include things like your social security number, your age, gender, race, religion, political affiliation, hobbies, marital or parental status, disability or national origin, license number, salary history, and an explanation of why you're leaving your present job. Some of those things do occur on a CV, but you don't need to put them they occur on a resume, but you don't need to have them on a CV. And this is, part of not, you give all the information, but you don't need to call attention to things that may have some implicit bias associated with them or may not, but it's usually better just to leave these off. On a CV, one of the nice things that you can do is add annotations, which are short narrative sections that explain the CV entry. And when you do that, you want to use active voice and include only the most pertinent data. So I give you an example here of some of the things that I've done. And so I developed a health sciences leadership workshop at the University of Utah. So I put there, what I did is I co-developed the curriculum and I served as co-director of the program for faculty development and leadership across health sciences, 30 faculty members in 6 3-day courses per year. So it really says what I did and how big the impact was or how little the impact was. But it helped to explain it to somebody who wouldn't necessarily know how much time it took or what that encompassed to be developing and directing that program. So I find the annotations very, very helpful. And the active voice, is that you co-developed, like what you actually did is the part there. It's important, well, you can have both an internal and an external CV. And so here I pulled from your website the California University's of Science and Medicine, School of Medicine CV requirements. And it's pretty similar, I think, to, it's a listing of a pretty common CV. And then on the left is the AAMC format. I personally have my own University of Utah one that I have to use for promotion, and then I also maintain an external CV in the AAMC format. And the reason I do that is if I'm applying for something that is a national committee or award or something like that, I find it very helpful to be able to send something that is more standardized across the country, and that's the AAMC CV. It does take more time to maintain two, but in the end, I feel like it's worth it. And if you're more junior in your career, or if, as I understand, many of you may have been practicing and then now you've joined academics, in some ways this is a great time if you're more junior because you can update it and include everything that you've been doing at this time. And it's not quite such an like, large document.
So I have a question in the chat.
Uh-huh.
Um, the question is, do you have to list the dates of your degree completions? I haven't because of age bias. When people see your graduation year, they do the math.
So you are, I guess you don't have to, but it is standard that you do the years. And yes, there is the potential for age bias. Because you're exactly right. People do the math. They'll check, particularly I think with the bachelor's degree is where people will do the math and try to figure that out. So, but traditionally, yes, you do include it. And that is, but that's why you don't include things like gender or religion or some of the other things that might have bias. But the standard is that you do include that. And I share the concern about age bias. So, although sometimes that can also work in your favor. So it can go either way. Were there any other questions there, Louise, or just that one? Okay, I will just keep going. So why you should keep and update and review your CV routinely is unexpected opportunities, maybe for a committee or something that you're like, oh, great, I can just submit my CV and you've already got it. You don't have to really work on it, which is kind of helpful. And often if you're applying for an award also, or maybe a grant, you may need to include your CV. I feel like this next bullet, the fourth one, is really the most important, is that you get to include the contributions that you might forget about over time. So again, as soon as you're finished presenting at a meeting, you put the information in there and it just makes it so that you don't have to try to remember it. The CVs can be adjusted also for your audience and purpose over time. So you might, if you're applying for something within a research arena, you may be highlighting your research portions of your CV. And so having it already up to date will save you time. And we already talked a little bit about the importance of an internal and external CV. I think your format looks like it's pretty standard and generalized. So that might be what you want to use. But you also might want to just use the AAMC template. And I think your institution is going to be talking a little bit about what could be helpful for a standard. So good habits make this easier, keeping everything, keep it in a folder, a drawer, a bin, a laptop, wherever. And that includes, I think, comments from students and things like that that you might be able to use later if you are doing an award type nomination or something like that. Again, make an appointment with yourself to update your CV monthly, and that can help you to not forget things, and it will save you time in the long run. All right, so now we're going to look through the AAMC template. I'm going to go through section by section, and we're going to do a little bit of what I like to call a gap analysis. And so that's looking at a blank template of a CV, and the AAMC is a good one to use, and looking at where you might have areas where you could improve, or you might want to do some activities in there to fill it. You don't want to just fill in every single spot. If you don't have an activity, you can also delete that area of your CV. But it's just a good way to kind of do an inventory of what you're doing and what you might need to be highlighting more in your CV. So as you're thinking about it, it can have you look to increase some activities that are more aligned with your track and that you can demonstrate excellence or effectiveness. So while you're reviewing your CV, I'd like you to think about these three things. So what are your major accomplishments? What are you most proud of? And what is your untapped potential? So that will let you realize what you really need to highlight within your CV. In terms of promotion, we usually think about these three, or the different areas of administration, service, teaching, funding or publications, which is the kind of the research realm, honors, and then clinical work. And clinical work is often not captured very well in the CV, so that's one of the things that I'm going to really focus on today. You need to know your own promotion guidelines so that you know what you need to do within each of these areas, and then that will let you know how you might be able to highlight them. Some of the real common gaps, I think, are things within administration and service that we might not think about. And what that demonstrates is kind of your local citizenship and how you work together with others and how you provide service back to your institution. But it's also a way that you can demonstrate your reputation either regionally, locally, nationally, as you provide service or have maybe leadership roles within different organizations. Editorial experience and presentations is also a way to demonstrate your reputation. Teaching, I really want you to think a little bit about the focus of your teaching, and I'll talk more about that in terms of the different learners. And publications and grants are kind of the coin of the realm for the research productivity and the way that you demonstrate that you are productive on a research type track. So also within some of these CV templates, I personally, if you have things that don't really fit anywhere, I created this new category, actually modeled off of another friend of mine, who created one for leadership programs. And this is really as I've worked to gain more skills within leadership, I had wanted to make sure that I demonstrated that I had done coursework to enhance my knowledge of different leadership. And so I called this out as a separate category within my CV. There is one in the AAMC that's professional programs, I think, or professional development. And so that would be another place to put this. But I specifically called it out for leadership because that was something that, as I've applied for different leadership positions, it's nice to call out that I've done the work to know at least some of the fundamentals of leadership. So thinking about administration, that's kind of where the CV starts as we're going kind of from top to bottom. I didn't include all of your professional, your appointments and things like that. So we can talk about that all if there's interest in it. But I wanted to get into some of the things that maybe are not quite so obvious. So within professional memberships and activities, I have broken mine into the different categories by the professional organization. So I've listed them, and the way you're going to see these slides, the top is the red is the category from the AAMC template, and then the bullet is listed the annotation from the AAMC. I've just copied it directly. So you can see that here I group the professional organizations. So my first one is the Pediatric Academic Societies. And then I note my leadership positions and other positions held. So, and then on the right is the years. And you can see here, having the years on the right, again, calls attention to the fact that I'm on the program committee leadership team. It doesn't call the attention to that's currently. You'll also notice that they're in reverse chronological order. But this makes it really nice within each organization to show a progression of your involvement. From like the American Academy of Pediatrics, you see that I went from a resident mentor now to being senior faculty in a leadership alliance. So it's helpful to kind of show your progression by doing it that way. Also then within your own institution, committee assignments and administrative services is another area. And I have broken this down for myself in terms of different, again, categories. And this should be both university and non-university activities, but I've broken it by level again. So like Utah System of Higher Education is something different than the University of Utah. And then I've got like my own department, my division, and perhaps other organizations that I've been a part of. Again, listing what they are. So the Project Marmalade, for instance, or Project Orange, I don't know if people would know what those are. So I've said that it's the Strategic Committee for COVID Response. And that was based on, just so that doesn't sound really random, but it's the red, orange, yellow, green that, we were using at the beginning of the pandemic. So that was why it was called Orange. But that I felt like did need to be explained. Is there a question? That's why I see the chat. I actually can see it. There we go. Oh, you thought that it was helping Paddington Bear. All right, so there we go. But it is COVID. So, but I don't want to think about COVID today. Let's see. There we go. Another thing is to think about, though, is university or hospital committees. Often for your first couple years, you don't really need to do as much committee service, but overall after that, because you're getting your feet wet, but then community service is often seen, committee service is often seen quite favorably. It's really important to choose something that's related to your clinical or research work, because that way it aligns again and you're not doing extra work. You can somehow work what your committee work is into your regular job. And you always should ask again, what's the time commitment before you accept, and thinking again about that passion. Is it something that you really want to do? Knowing sometimes we have to be on committees that we may not want to be on. There are lots of different academic committees in most institutions. So, I think your institution is maybe a little bit different here, but curriculum committees, your promotion committees, the IRB for research, all of those are different ways to think about becoming involved in academic communities. And other committees or state or local committees are really a place to maybe be able to provide some service. So Department of Health, the governor often have multiple boards, committees, commissions that need health advisors. So that might be a place where you could have some committee service and really make a difference. Also, your professional societies are another place to think about in terms of administrative work. You'll want to list them on the CV like I just showed you. And a lot of times this can add, you can have the additional committees because there's awards committees, research committees, you might have an elective leadership role. I personally have found these incredibly helpful for then if you're going up for promotion to professor and you need to have letters from others. This is a great way for you to have learned and met others in your community of scholars, so that then they can help you to progress in your career. So next is clinical and quality improvement activities. And in this one, you'll want to think about different activities that you do. And you want to include also the number of weeks and percentage of time and effort. And I'm just looking at this and realizing I didn't do that. So attending physician at the South Main Clinic, I say what kind of clinic it is. What I don't do here is say, how many hours per week. Now I'm going to show you later where I do have some of that. But if you are primarily clinical, I think it's important to say that, you spend this number of weeks or you spend 80% of your time in the clinical setting, because then that makes it a little bit more difficult to do some of the other academic endeavors. And you need to have credit for what you do in the clinic. In terms of clinical service, you really want to think about that you're providing high quality care. You want to think about maintaining and improving your clinical skills. And part of that then can be to participate or lead a quality improvement project as a demonstration of the fact that you're doing clinical work and it's of high quality. I'm going to skip that one. I'm going to go into educational activities, and this will link back to the part about the clinical teaching at least. You might want to do within your CV, and this depends again how many educational activities you have. If there are a whole lot, you might want to say see attached teaching portfolio, or you can make it kind of an abbreviated teaching portfolio perhaps. Within educational activities, and again, this is copied right from the AAMC, you want to think about different roles that you have. And I'm going to show you a little bit of this and it'll make more sense in a minute. And this is so wordy, I'm going to just go on. You really want to think about the different educational activities you do. And this is a nice way to categorize them. So educational administration, training program committees, course and curriculum development, courses directed, didactic sessions, clinical teaching, laboratory teaching, small group teaching, and graduate student committees. These are, and now if you have others that you think you need to add in there, you can always create new categories. But this thing is, again, thinking quite broadly about education. And you want to think about where you are doing your teaching. So are you in the clinical realm? Are you doing it in the research realm, didactic? Are you mentoring others? Mentorship is a form of education. And then thinking, what is the level of the learner? Are they undergraduate students, kind of pre-med? Are they medical students? Are they residents, fellows? Are they other faculty members? Or is it community members that you're teaching? Because each of those roles is just a little bit different, and you need to call attention to the fact that you teach across multiple different learner types. So this is my CV and this is where I focus my career, is really in education. So um, you can see here that I start off with educational administration, and those are my director roles. When I've done this presentation in the past, we've really talked about, do some of these things go up in the professional experience? You want to choose where you list it. So for me, showing the progression that I've done in terms of educational administration, I think it's helpful to have here. So that's why I've got them here. The next part I want to call your attention to is that there's something different between course and curriculum development and courses directed. So you can see here that what I talked about before, the health sciences leadership workshops. Well, actually, I kind of messed that one up as I'm looking. Oh, I think I didn't copy it here. It doesn't align because these are different years. You can see that developing the course or the curriculum is different than directing it. And so it's okay to put the same thing in two places. So for instance, the Masters of Education and Health Professions that I'm working on right now, we're working on developing it. So I've co-developed the curriculum for a 30 credit Masters of Education degree, right? But then I'm directing a couple courses within that. And again, that's something different than the curricular development. And so you can separate those out. And I think I saw it flash that maybe there was a question. Is there something, Louise?
Yes, Dr. Nasreen is asking if you will be able to share your PowerPoint slides.
Yes, I will share these because I think that seeing the examples from what the feedback I've had in the past is actually the most helpful part. So yes, I will share my slides with you.
Thank you.
Let's see. Okay, great. Yeah, and I hope it's helpful. I've been told in the past that it is, because I think some of these things are a little bit hard to kind of wrap your head around what they should look like. You can also see here, like down here, this course that I directed. Again, I say how many times per year. They were third-year pediatric residents. It's a required rotation. You know, put the information in there so somebody understands the body of work by just looking at your CV. But again, they're short. They're not long, big long explanations, just nice short things. Let's see. There we go. This is one of the ones that I know many of you are likely clinicians. And when we do clinical teaching, it's a combined activity, right? We're seeing patients, but we're also teaching. And that takes more work than just seeing patients, and it takes more work than just teaching too. So calling attention to the fact that you do both at the same time, I think is really important. So this is mine, where I do and this is why my other part where I do clinic, most of the time I am teaching in clinic. So this is now where I show it. I don't have a faculty practice anymore. And so this is really where I demonstrate my clinical activity. So I supervise 1 to 4 residents at the South Main Clinic, 2 half days per week. And that's been going on, for whatever number of years. Again, then like well baby nursery, 2 pediatric interns, 1 family medicine intern, 2 medical students. And then, I did it 3 to 5 weeks per year. And then I changed and I just did weekends. So that's just trying to demonstrate what I do there. And I think this is something that a lot of people don't include on their CVs. And I think it's really, really important to do so. Thinking about continuing education courses, educational lectures. Some of these things might be grouped together if you want to. Continuing education courses, I think of more as that you are giving CME credit, or they are for faculty might be a way to think about it, whereas the educational lectures are really just didactic lectures, usually to students, although you can see here I've got some of mine that's to the community physicians group. And so that probably could have been in that other section. I actually wonder if it might be more appropriate just to collapse these two sections. I'll also call attention to my formatting is off here because it's not consistent. So this is something where, again, looking at something like this on a big screen makes it more apparent when you have inconsistencies, and that's something that I need to go fix. Wanted to really talk about mentoring, and I think this is super important to include on our CVs and sometimes also is not included on people's CVs. So you want to track this on your CV. You can have a mentoring section. If you are ever applying for an NIH grant, and even I think for awards and things, it's very good to include the mentee outcomes. And on here, I have some of the, at least under the fellows, I added the trainees accomplishments. So you can see that I mentored Rebecca, and it was while she was a hospitalist fellow. She defended her MSCI, and then she became an assistant professor of pediatrics. Now, I do not include, nor do I advocate that you should include if you are, that everybody that you teach is a mentee. So a mentee is really somebody that you're spending additional time with and mentoring through some sort of a process or a project. Or it can be kind of a career mentor, but not necessarily just somebody that you are assigned to teach all the time. It's something that's above and beyond that typical relationship. Honors and awards, I think, is perhaps a little bit more clear cut too. So competitive scholarships, fellowships, name of your scholastic honors, your teaching and research awards. And so you want to go ahead and just list all of those, again, with the dates on the right. So now I'm going to go just a little bit into scholarship or investigation, research. You can call it any of those different kinds of things. One of the ways that you can really build your CV in this is to be an ad hoc reviewer for journals in your field. If anyone is interested in reviewing for MedEd Portal, you can send me just send me an email and we can get you signed up. I'm one of the associate editors, and it's a great way to see what is going on in your field and help you to be able to build even more expertise. You can write to a journal editor and list your areas of interest and give them an idea of the papers that you'd like to be able to review. And most of these things are web-based, and so it's something that you can do over time. You can just do from home or wherever. And that helps you to, again, build your CV. In terms of grants and contract awards, these are also important to list under the sections of pending, current, or past. You do the reverse chronological order. You need to say the granting agency, the award total, and the direct and the indirect costs, or the direct and the total costs is the way that I have it on mine. And that, again, is a pretty tangible way, I think, to demonstrate some of your activities. If you don't have any grants and you're an educator or a clinician, that's okay. So don't, this is mostly, I think, for research type folks, this is a measure of the way that they are succeeding in their research career. In terms of publications, I wanted to call, this is just a standard formatting, pulling from PubMed. You always should highlight your name. And then you can see, like on the top one there, I've got an asterisk next to the second author. He was my mentee at that point in time. And so, you get credit for having a mentee as an author on your paper. Now, this is probably more important as I progressed in my career, where the mentee may be the first author and I'm the second or last. And that demonstrates, like on the bottom one, number 9, Kayla was one of my mentees in genetic counseling, and I was the senior author. So by having a mentee who's the first author, it kind of gives me credit for both being a author, but also having mentored it and allowed my mentee to become one of the very first, one of the first authors. So first or second author. So that's just you add that little asterisk and say what it's for, which you can see up here is what I had done. So thinking about different presentations, you can do things at your university, regional meetings. If you haven't given a lot of presentations, one thing you could do is reach out to a regional hospital or an area and say, hey, I'm interested in delivering this content. Would you like me to? And I'll say that's partially how I think I'm doing this today, is that there was a query on the Dr. ED listserv, and I said, oh yeah, I do that, so I'm happy to do it. And then here I am today. So again, just reach out or offer to present things, and often you can then present, which is really a way to put things on your CV. In terms of oral presentations, this one I think is also really important. So this is where, if you're an author on a presentation, you put it in here, and their categories are invited national or international meetings, local or regional meetings, peer-reviewed presentations, and that includes workshops. So one of the things at some national meetings, there is a process by which workshops or others, scholarly sessions, go through a peer-reviewed process prior to being accepted. I'm going to show you what mine looks like there, because I think it's an important way for educators to be able to demonstrate what they've been doing. So this is part of mine for my peer-reviewed presentations and workshops. And number 16 there shows that at our Pediatric Academic Society meetings, we actually get a tally of how many workshops were submitted, and that the acceptance rate is only 28%. I think that's important then to include, because it's really a high bar, and it's to say that I developed these in a scholarly manner. They then were submitted for peer review and were accepted to be presented. And then you can see I put there how many, how long it is. Also, I think if I knew how many participants, I'd put how many participants also. So a really nice way to reflect, again, your work that you do. And these often can count as something similar to a peer-reviewed publication. If you present it multiple times, you do get to list it multiple times. So that's because it's accepted, multiple times, which is just a demonstration of the quality of the activity. Social media is something that is kind of up and coming, and different universities deal with this a little bit differently. But it's a way for you on your CV to list your professional activities utilizing social media. And the Mayo Clinic has really done a nice job in talking about how you can use social media for academic promotion. And that has the link there to the article that's available to download for free. That had been published in the Journal of Graduate Medical Education. So that's a really great, if you're interested in social media, that's a good place to look. The other areas are just other creative products. So this is where you can add blogs and CDs, interviews, simulations, websites, all those different kinds of things that there might not be another spot for. And here you can see I do similar to up above, where I say, that I was a presenter, the topic name, that I did it for the AAP YPLA, that I did it with a co-author, and how long it was and how many people, and that it was recorded. And you can see this one, I did it multiple times with a different co-author. So that just shows that I do repeat that I've done it multiple times. Other scholarly products can also be things that maybe are not peer-reviewed. Journals that you have, that's my first one there. Some of them are also just tips that I've published. One is number 7. There is an EPIC smart text that I created for Down syndrome that then had been downloaded. So, and it's part of EPIC user web community library. So you can put things like that too, that demonstrate that you are sharing your content with others. And again, having some sort of a, you're getting some credit for some of the work that you're doing on your CV. Patents and technology transfer is also something you'd want to do, and they're in chronological order, which is the same as your publications. And that's because I think people who have patents and technology transfer, of which I do not, often have multiple, and so it's easier to add them in chronological order than it is in reverse chronological order, which is the rest of your CV. Professional community activities are ways that when you engage with the community that you can list what you do. So if you're this is mine as I was a guest on a radio show. And so I put that here with the link, and it's a way to show again that I'm getting out in the community and I am sharing my expertise as a pediatrician. Okay, phew. So that's kind of the end of the formal part. And what I want you to really think about is what's your next step to document your accomplishments, and give yourself some time to put that in your calendar, so that you can take the time to work on your CV and build it up. I guess I'll just open it up now for any questions. And then I do have, if you would do this for me, I'd be appreciative. I do have an evaluation survey that's on poll everywhere. You can copy it. I'll also send it so that you can fill it out later, but it's just about, I think it's less than 10 questions. Basically, did we meet the objectives? Did I meet the objectives in this presentation? What was helpful? What was not? And the reason I would love for you to fill this out is so that I can improve, but also so that I can potentially upload this to MedEd Portal so that it could be, well, not upload, that I could submit it to MedEd Portal, have it be peer reviewed, and then be able to share this with others, so that other people could use this formatting to be able to share at their institutions. So with that, I'll just see if there's any questions.
All right, thank you. Do we have any questions from our audience? Can unmute or put it in the chat.
I have a question. This is Linda.
Yeah.
I'm just curious. I know when I look at CVs, there's sort of things that I'm like, ooh, that drives me crazy when people put on it. I'd just be curious from your perspective, what's something that you see people do on a CV that you think stands out as being like, ooh, don't do that.
Yeah. So I think it's that question of, so it's almost like there's the sandwich, right? And is it the whole sandwich or do you slice it up too much? I get a little annoyed when people maybe slice it too much. So there's a fine line between documenting how much you do, but not overdoing it. I get annoyed, as you might have already kind of caught when I was talking about mentorship. I get really annoyed when people say that they mentor every single person that they teach, because I think that's not really realistic. And they're different roles. So I guess I get annoyed when I see that people are embellishing and trying to make it look like they're doing more than they actually are. So,
Thanks.
yeah. And was there a question from?
I think we're seeing a lot of thank yous. Probably people have to run to their
Which is
thing.
Totally fine. Totally fine.
May I ask a quick question, please? This is Susan.
Yes.
This is Susan. Thank you. Would you list all the courses that you have taught?
Yes.
All of them?
Well,
Even
so here,
if it is too much?
Yeah, well, because the CV is a listing of all of your work. So I'm going to go back up to the courses here. I guess I only showed you the ones I directed. So one of the ways you can do it is, and I don't know if you can still see the chat there. So here, this one, like I've taught this one multiple times. This is a lecture more so than a course. But then you just show that you've done it over multiple years. So if they're consecutive, you line it up that way. And that's a way that it won't be as huge of a list, but it still demonstrates that you have taught this course for a long time, because you should get credit for teaching it a course for a long time.
Thank you.
Mm-hmm.
Can I ask a question?
Sure.
So I was kind of curious, I might be in the minority, but I was kind of wondering about like hobbies in general. I thought there was a slide about maybe not necessarily including them. Is that something that's kind of like normally accepted within the academia world when you're interviewing for different faculty positions, or I just wanted some more insight on it, because they do include in the AAMC applications with the medical students. I always use that as my segue to kind of start the interview and kind of get to know them. So I was kind of wondering what was the overall. I'm new to the world of academia, obviously, so I kind of was thoughts were.
So that's a really great point, that they do have it as for the medical students, but it's not included for faculty members on a CV, because it's your academic world. It's not your outside interests necessarily, although I think sometimes you can see some of the kind of community activities you may be able to extrapolate a bit what hobbies are, but it's not really it's not about your personal statement, your personal summary. It's more about your academic accomplishments. And so that's why I think you don't put the hobbies on there. It just doesn't seem to fit with an academic CV. So we recommend not including them for that reason.
Fair enough. Thanks. Appreciate it.
Mm-hmm. And honestly, that's a little bit of the difference that I showed initially between the CV and the resume also. Because the resume, you do add those kind of things, and it does make it easier to make that connection at the beginning of an interview, for sure. Although it also might make us be biased in including people that are like us rather than people who are maybe different than us. So it's probably better in that way not to have it.
So we just have a comment there in the chat from Dr. Green saying it'd be great for us at COS to pursue MedEd portal publications and reviews more and to standardize ICVs with the format provided by AAMC. And I definitely agree. I was not aware that format existed. So, okay, it looks like we're about out of time. Is there any last questions? Okay.
All right.
Well, thank you, Dr. Hobson-Rohrer. It was a great presentation. Really appreciate it.
Okay, good. I hope that is what you needed from it. So thank you very much for having me.
All right. Thanks. We'll look for that link.
Up the share. Yes.
Okay.
Okay.
All right. Thanks so much. Enjoy
Thank
the rest of
you.
your day.
Okay. Thank you. You too.
All right. Bye-bye.
Bye.